So hey everyone, my name is Dr. Cameron Boggs and I am a horse vet. So today we are going to kind of look at a horse truck with all of our supplies and kind of relate that to when you all go to like a doctor's office. So when you go to the doctor's office, you have everything in that building that they could possibly need, but we have to go out to where the horses are on the farm. So we have to take everything that we need that we could possibly use with us. So this is what my vet truck looks like. So this is just what we call our box. So in our box we have all of our different drawers, and we can kind of go through our drawers and kind of see, but kind of the basics. The first thing I always grab at an appointment is our stethoscope. So like when you go to the doctor, your doctor will listen to your heart, listen to your lungs, and as horse vets we do the same thing. So this is our stethoscope. Kind of going along with that, we also have in our tidy little basket a thermometer. So we take their temperature just like your doctor takes your temperature. And then let's just kind of go through some of our drawers as to kind of what supplies we might need. So let's say you go to a call and you have a horse that cut itself. So like if you get a cut, you have to get a Band-Aid. But as you can imagine, horses are really big, so we have to have big Band-Aids. So like we can use any of these supplies right here to make a bandage for a horse wound. So like little Band-Aid pads, big Band-Aid pads, and then like this kind of looks like the same color as Band-Aids, but this is like really sticky tape that we can use to secure all these things. So this is kind of the drawer I go to for any like wounds or lacerations. And then in our next drawer, we kind of have our gloves. So like when, like especially now with coronavirus, you've seen everyone wearing gloves, so that's where this comes from. These are my sterile gloves for like procedures like joint injections where we're like going into a joint, like our knee joint or something like that. Here we have an ophthalmoscope. So an ophthalmoscope is what they use, your eye doctor uses. So if you have contacts or glasses, I'm sure you guys have seen these. So this is a way that we can look into the horse's eye, and it has a light, which this one's dead today, but that's great. And then we have more eye meds, eye baskets, and then kind of going down. This is our like scrub drawer, I call it. So like if those horses with wounds need to be scrubbed and cleaned, this is where we come here for that. This also has all of my surgical instruments. So like if a horse needs sutures, I'll use suture material, and then I'll use instruments to suture in the wounds. So suture scissors, like tweezers, scissors, all that lives here. And then moving on here, this drawer kind of houses some of my buckets and dental speculum, which you guys will see later in another episode of Floating Teeth. So that's here. And then just some other medications and stuff that I use. And then here, this is my pharmacy drug. So like when you guys go to like CVS or Walgreens to get your drugs, I kind of carry that on my truck. So this has lots of the drugs that any horse that I see during the day might need. It's not all the drugs that we carry, but this gets us through a day pretty well. And then this drawer houses all of our syringes and needles. So different sizes syringes and needles. So like when you get your blood drawn, your doctor would use similar supplies as to what is in this drawer. Except of course, as horses are big, so we have big needles like this as compared to you probably get a needle this size when you go to the doctor. And then kind of back to the pharmacy thing. This is my drug drawer. So any medications as far as like sedation or things to make horses go to sleep for procedures, antibiotics, if they have a cut and an infection, all that kind of lives in this drawer. And then our last upper drawer. So this is kind of my lab drawer, I call it. So like if you get blood drawn and you have to send it off to the lab, to let them read measurements in your blood, this is where I come. So these are all of my different blood tubes, different colors for different things. And and then some specialized little blood kits that I can do on the farm for blood work. And then kind of, oh, one more drawer, this one. So horses a lot of times get something we call colic, which really means just like a bellyache. So in this drawer, this is my colic drawer. So I have syringes, so I can use to tube things, and then another syringe like this. And then we use this really, really long tube to put up the horse's nose, down their esophagus, into their stomach. Because they can't throw up like we can, so we have to do it for them. So when they get a bellyache, we help them out that way. And I think that is kind of everything kind of that I need on a daily basis.